I'm Dr. Jerry Hesch, a physical therapist from the Hesch Institute in Aurora, Colorado. And this is my client, Betty Brown, and she came from Indianapolis. And I treated her almost a year ago, and her husband, Dr. Brown, is accompanying. And he's going to describe her injury and her treatment from his perspective.
My name is Dr. Terry Brown, and we're from Indiana. I practiced medicine in Indiana for 35 years, and I still maintain my professorship with the IU School of Medicine. My wife has had lower back problems for about the last 4 years, and she has seen a number of specialists in Indiana, including 2 back specialists and several chiropractors, and had never really received much relief. She also saw 2 different physical therapists during that time. We got the name of Dr. Hesch from one of the back specialists that she saw in Indianapolis. And really, as almost a last minute type thing, we decided to come out here and give it a try because nothing really had worked, including multiple back injections. When my wife saw Dr. Hesch, she was able to come up with a diagnosis fairly quickly. And by the end of the first visit, she was feeling better, and by the end of the second visit, she was absolutely pain-free. We'd actually scheduled 3 visits here and found that it was unnecessary to even keep the 3rd appointment. My wife has done remarkably well. She does occasionally see her chiropractor back home, but her pain, which had been probably a 6 or 7 most days, and made her traveling in a car for any distance nearly intolerable, is now on the worst days maybe a 1, and we were able to drive from Indiana out here to Colorado, a 17-hour drive over the course of about a day and a half, and she did so very, very well. Today, when Dr. Hesch examined her, he found a little tightness in her left hip, was it?
Right hip.
Yeah, right hip, which he again easily corrected. And now, again, my wife is feeling quite well. So today was just a little tune-up since we were out here anyhow. Always nice to kind of get a quick checkup and make sure things are doing well. All of the adjustments that he made last year in September were still right where they were supposed to be. So we're very happy with the results of her visit from last year and again today. And she continues to do well, doing what she wants to do at home. Thank you, Dr. Hesch.
Sure, thank you. Can you compare the treatment that she got here? How is the actual treatment different than other treatments she's received?
Well, the treatments that she had back in Indiana, physical therapy appointments, which actually made her pain worse. Just, seeing a standard physical therapist with physical therapy exercises really made things worse. She had a course of probably 4 steroidal injections. If I remember correctly, she had 3 in her sacroiliac joint, and she had 1 in her L4, L5 facet. The results of those were mixed. They might last for 6 weeks at the most. The one in the facet probably didn't last more than a week or 2. Mm-hmm. When she saw the one of the back surgeons, he had suggested permanently closing the SI joint on, was it your right side? The right side. And everybody else we talked to said, "Oh, please don't do that." I think, can you think of anything else? And she had prolotherapy injections into the SI joints. And the first time she had those, a series of 3, they seemed to help for 2 or 3 months. But then when she went back, the doctor that had given her the first 3 injections had left the practice, and so the nurse practitioner gave the injections, and they really did no good whatsoever.
Yeah. And then what I was trying to hint at was I would submit that my treatment approach takes longer. So when we moved your sacrum on that first visit, we took 10 minutes to do so. And the other thing I would suggest is that it's probably a lot gentler than any other method of mobilization. That's just my perspective.
Well, I think you're absolutely right, especially compared to the chiropractic adjustments, which did seem to help, but they were just more of a rapid hip movement or lower back movement. There was nothing like you did with the slow, steady pressure, or even just simply putting her one side of her pelvis tilted as opposed to the other side on your little styrofoam wedges.
Mm-hmm.
And it was interesting when we saw the chiropractor, Betty's chiropractor in Jasper, after we had seen you, and I was describing these wedges, he said, you know, that reminded him of a chiropractic technique that he had been taught when he was in school, but that not many people used. And so he actually had some wedges.
Yes.
And he put those underneath her lower back and her upper leg on the other side. And when he did the adjustment for her, he said, "Oh my goodness, that's the easiest I've ever been able to move your L4 L5 facet."
Yes.
He was just really astounded by it, how that had made things work so much easier.
Nice. And so you feel like you have the tools for managing it yourself, except for episodic chiropractic visits?
Yes, definitely.
And how often were you seeing the chiropractor before you came to see me?
Whenever. I always scheduled every 4 weeks.
Yes.
But I always called in between time.
Yes.
To be worked in.
Sure.
Sometimes it may have been 2 or 3 times a week.
Sure.
Sometimes maybe it was 2 or 3 times between scheduled appointments.
Yeah.
But I always felt good when I left his office.
Yes.
But by the time I would get home, my back felt the way it had before I saw him. And it was so frustrating because I didn't know why it wasn't lasting.
Yes, yeah. And so now you feel like you have the tools to self-treat most of the time.
Yes,
Yeah.
we do. We both of us do.
Great. Yeah, and that drive, you just drove in today.
Yes.
So the trip Dr. Brown was referring to was just yesterday and today.
Yes.
Exactly.
Yeah. So, well, good. I'm really happy for your progress, and it's nice to do a tune-up because you never know what you'll find, and we found one thing.
Yes.
And I think that one thing will make a big difference.
Great.
So thank you.
Thank you.
I appreciate it.
Thank you.